Bangladesh is a place of transformation, urbanization, and economic growth. On this learning tour, CARE showcased the great strides Bangladesh has made to improve the health and livelihood of its most vulnerable households.
On a learning tour like this, we had a congressman, but we also had with us corporate leaders and people who, through their work, really reach a big portion of the American public.
I think it's always important to have a chance to see action on the ground. Reading about issues is important. There's no substitute for seeing it.
One of the organizations on the front lines of developing successful maternal health interventions is BRAC, the Bangladesh Rehabilitation Assistance Committee. Their program, Minoshi, provides clean birthing centers and trains health workers on using mobile technology to track expectant mothers' progress.
It's our first trip to this region, and we heard so many good things about the work in Bangladesh that we wanted to come see it firsthand.
Before BRAC, there was no place here for people to deliver except in their home. So now they can go to a space in their neighborhood. They're prepared to help get you to the hospital so that complication can be treated.
This afternoon we have the U.S. Embassy country team here with us, which also includes USAID. They're here to present on their health, education, and economic projects.
The maternal mortality survey just came out in Bangladesh. I'm sure you've seen it in the news. But it shows that Bangladesh is on track to meet the Millennium Development Goal in maternal mortality. More women than ever are actually delivering in facilities, and more women are having C-sections, and more women know the danger signs.
CARE brings together people from all kinds of perspectives that are engaged in these issues of trying to create development opportunities in the developing world. And so I feel like it enhances the trip and gives it a lot more depth.
Everybody has been so amazing. I just think we all learned so much from each other and allowed us to sort of see not just one perspective, but a lot of different perspectives.
One of the major areas where women have found employment is the garment sector. 90% are young women. The delegation met with these women after their long workday at the Wheel Project Classroom, where they learn life skills, literacy, numeracy, and health information. The delegation traveled northeast to rural Narshingdi district to visit one of CARE's flagship maternal health projects, the Safe Motherhood Promotion Project. The Village Health Committee developed a map of the pregnant women in the village to monitor their progress and implement a birth plan in the event of an emergency.
One of the interesting things here is they have the mobile phone number of the doctor in the hospital. So for one thing, they are able to telephone to the doctor that there's a complication, that somebody is being sent to the hospital.
More recently, Bangladeshi healthcare has evolved into a combination of public and private interventions. Upazila, or regional hospitals, still serve as the healthcare hub of many communities and provide comprehensive emergency obstetric care services, including cesarean sections. The delegation visited the Shahardo program in the highly vulnerable wetlands of northeastern Bangladesh. This program is USAID's largest initiative in the world addressing chronic food insecurities.
This is a community that gets flooded every time during the monsoon season, and they've built out the wall, they call it, to give them more land, and they've maintained their community. They've dealt with public health issues from maternal health. It's really interesting how this community has taken so many variables and really enhanced the life of that village.
Everything's so lush, and the women are so beautiful, the children are so adorable. The whole community has just, warmed my heart.
There's so much to think about and so much to see. It's been an absolutely fantastic experience. I don't know if I would ever have done this.
The MDG goals were really an ambitious effort that was established, and what's interesting is that in Bangladesh, you're seeing real progress on so many of these fronts. The maternal mortality rates have dropped so much, infant mortality rates. It's really exciting to see what's going on, and other countries around the world can learn from the innovative activities going on in Bangladesh.
And together, I think what we are really trying to do is to build a global civil society to help mobilize a voice both in Bangladesh and in the world more broadly to really say zero tolerance No woman should die in childbirth.